And now, I would like to welcome an exceptional academician and a visionary leader, Dr. Bhagavan B.C. Sir, the Vice Chancellor of Rajiv Gandhi University of Health Sciences, Karnataka, to please come forward to address the gathering with a huge round of applause.
Good afternoon, everyone. Sorry for the delay starting of this graduation. We have on the dais Honourable Minister of Karnataka, Minister for Medical Education and Skill Development. As he was introduced by Mr. Amar, he is one of the best ministers for medical education that this state of Karnataka has ever seen. I don't mince my words when I say he has worked so much for the welfare of medical education and health, and now for the skill development. He himself is a doctor, and he has come up from the grassroots level of politics, understanding the pulse of the people of this state, especially from the northern Karnataka. And during his last tenure and this tenure, he has been encouraging our university, Rajiv Gandhi University of Health Sciences, and he also brought a lot of reforms last time, and this time he is proposed to amend few things. So sir has been a constant source of inspiration for all of us to achieve, and it's very honored to share the dais, and he has given his wisdom words to all of you today. We have Sri Muniraju, my old friend from last 20 odd years, and I have seen Muniraju struggling in his initial days, and how hard he had to work, and there were thoughts that whether he could really achieve and bring the institutions to this level. Today, with his efforts, perseverance, patience, and excellence, the institution is one of the best in the state of Karnataka. Rajiv Gandhi University is very proud of it, and very proud that Sharan Prakash Patil sir was instrumental in sanctioning. A big round of applause to him for bringing up such institution, and he appreciated the contribution of private institutions to the sector of medical education. You know, I am the first Vice Chancellor from a private sector, and everybody had their own reservations whether a private person could deliver. Hopefully, with the efforts of institutions like this, we can definitely achieve better standards in medical education for this state of Karnataka. We have Mrs. Pushpa Muniraju, Mr. Amar, budding educationist and entrepreneur, Mr. Sri Akash Muniraju, my old friend Shiv Prakash, who has really worked in this institution very hard to bring up to this level. My old friend again, Dr. Naresh Shetty, who was in Ramaya, who was excellent administrator, Dr. Brijesh, Srimati Chaitra, and Manjunath. I recognize the presence of Dr. Anjanappa, the director of Kempegoda, Rajya Okkaligra Sangha, and ex-chairman of Kempegoda Institute of Medical Sciences. He was my chairman when I took over as the Vice Chancellor. And our Dr. Jagdish, syndicate member, Rajiv Gandhi University, and all the esteemed teachers. Many of them are from KIMS. I am very happy to see them here, and few are from Ramaya and other prestigious institutions. Today, is the culmination of all the hard work, the efforts, burning of midnight oil, and the dedicated work that all the graduates, postgraduates, and paramedical people have done all these years. It's the result is culmination of their hard efforts. As our Minister, sir, rightly put it, congratulations to all the parents and the grandparents. I see many of them are here. A big round of applause to your parents and grandparents. They have wished, they have worked, they have thought more about you people and your education, your career, your future more than what you have done today probably. So they deserve all the accolades. From this academia to professional life you're passing out today, all these years you're protected by your teachers. They used to give you tests. They used to teach you first and give you tests and you could pass it. But the professional life outside is not like that. It gives you tests and then makes you understand life. So you should be prepared for a more competent, more professional life outside this academia. As the Minister Sir put it, you're one of the privileged and luckiest professional because you are entering the noble profession. We all treat human life. India, as he mentioned, has 1,15,000 students who can graduate from medical colleges, and NEET exams is seeing the rise every year. Rajiv Gandhi University has around 8,300 seats in medical and about 3,500 seats, postgraduate seats. And you are the luckiest and very privileged one to be amongst this profession. I quote Dr. Babcock, who said, "Be strong. We are not here to play, drift, or dream. We are here to lift lot of loads." It's a great challenge, and God's willing, face it. As you all pass out today from this institution, this is not the end of the road. It's a milestone, a checkpoint for all of you, and a new beginning. You have reached the threshold of a noble and demanding profession, a profession that demands not only knowledge and skill, but also compassion, sensitivity, and a deep sense of duty towards society. All of you hold today in your hand the medicine of future and the future of medicine. Let me speak to you on 3 counts, vital themes, I believe will definitely define your journey in the years to come. The importance of continuing to learn the irreplaceable role of human and empathetic care in medicine, and your sacred responsibility to serve the underserved. When you walk out of this institution and auditorium as graduates, remember that your degree certifies the completion of a stage, not the culmination of your education, because medicine is a living, evolving science. What you have learned so far is the foundation. What lies ahead is an ongoing journey of discovery or self-realization and creating yourself. As Dr. Abdul Kalam said, you all hold a degree certificate. Anybody can hold a degree certificate in his hand today by just mere studies, but you always should think that whether you are worthy enough to have a degree certificate in your hand. You all have wings of fire You must all dream. The dream should be such that it should never allow you to sleep. In the last decade alone, we have witnessed the emergence of telemedicine, personalized medicine based on genomics, artificial intelligence in diagnostics, minimally invasive surgical innovations, and breakthroughs in immunotherapy. These advances are not only redefining how we treat, but also how we think about health and disease. Today, to stay relevant and responsible in your practice, you must be a perpetual student. I just quote the words of great Bill Gates, who said few weeks back that in another 10 to 15 years, we only have to work for 2 to 3 days in a week, not more than that. What he meant was the artificial intelligence, nanotechnology, the computer navigation systems, all AI-based technologies are going to take away all our human resources. Only survivors would be the professionals who can utilize these technologies, who can adapt themselves to the advances, will survive. So you must be prepared yourself and well geared up for the occasion. As the Vice Chancellor of Rajiv Gandhi University of Health Sciences, I urge each of you to make continuing medical education a core part of your professional life. Attend conferences, enroll in certificate programs, participate in research programs, engage with journals and online learning platforms. Rajiv Gandhi University of Health Sciences has given you enough opportunity to be a research specialist. As a student, this is probably one of the only universities in this country who encouraged the undergraduate research activity by promoting and helping you with research grant of approximately 30,000 rupees for each student. The staff were given around 30 lakhs research grant, and we encouraged throughout. Now we are coming up with a state-of-the-art research hub at Bhimankuppe, which will be ready by the end of this year. State-of-the-art campus at Ramnagaram, which will be ready by early next year. All these facilities are going to enhance your education. We also have RATI, Rajiv Gandhi University Administrative Training Institute for Teachers, which has taken off 3 years back and progressing extremely well. We are also encouraging the skill labs. Honourable Minister has already announced skill labs at 5 places, and also AHS and other allied health sciences, physiotherapy colleges in different districts of the state under the government of Karnataka, which will encourage more and more students to get involved in the healthcare system. Too often in our healthcare system, we see patients reduced to numbers, to bed counts, to lab reports. Let's remember that we are dealing with lives, not just diseases. A kind word, a reassuring smile, a few extra minutes to explain a procedure, these simple acts can be more healing than any medicine. We live in a country where access to healthcare is still a privilege for many. If you remember, Boer Committee, which was constituted in 1934, were defined about the healthcare system, basic doctor of modern medicine, where hygiene, population was given more emphasis. And today, in the last 100 years, it has come to a big circle and a lot of advances in the healthcare system and public health. You are amongst the privileged few who have had the opportunity to pursue medical education. With that privilege comes responsibility too. You must use your knowledge and your position to serve those who need you most in the society. Whether you choose to work in a hospital or in a private clinic or pursue research, always ask yourself, how I am contributing to the betterment of society. Our Honourable Minister rightly put it that you must develop the skill of communication, you must develop the skill of getting into research, analysis and reporting. That's when you survive in the society. Find time to your career to serve the underserved, volunteer at health camps, support public health initiatives, advocate for equitable health care, mentor students from disadvantaged backgrounds. The measure of a doctor's worth is not in the titles they earn, but in the lives they touch. Remember, the true success of a medical professional is not in the wealth they accumulate, but in the trust and blessings they earn from these they serve. On behalf of Rajiv Gandhi University of Health Sciences, I congratulate again one and all who have graduated here today from the field of medicine and paramedical sciences. Always remember that you should be a role model to the society. Shun 3S, smoke, spirit, and stress. And the biggest menace the society is facing today, the drug abuse. Always remember that whatever the law of the land says, patient is never a commodity or a customer. He is always a human being with a beating heart and a thinking brain. And it's our duty to keep the heart beating and the brain, to keep the brain thinking. Every patient may not be conducive to you. He may abuse you, he may scold you, he may try to beat you, but always stay above that plane of interaction. And if you are not required at the situation, just walk away from the situation. Don't feel bad, because there's always thousands of other lives waiting for your care. And always keep blessed. May God protect you in your journey, and may God help you to achieve better things in life. But always remember to come back to your alma mater, give back to your juniors, pass on and percolate the knowledge that you acquire from whichever part of the country or the globe. Percolate the knowledge and help the society to grow and serve the human life. Thank you very much. And I thank the college management and all the teachers for giving me this opportunity to be amongst the crowd. I always appreciate the teachers who have done excellent job. A good teacher teaches, a better teacher demonstrates, and a great teacher inspires. All the teachers here have inspired you today. Teachers are like injections. They are painful when you're in the class, but you realize after you pass out, these injections has cured you and helped you to become a better citizen and a better professional. Thank you very much.
Thank you, sir. Thank you so much for your wonderful words.